Okay, cool. Yeah, so in the interest of time, we'll just get this started in the next 1 or 2 minutes. Maybe as we are just working on that, what you can maybe do for those who have joined, the chat function is active, so maybe you can just note there where you're joining from, probably your interest in the snake hack. Are you interested in collaborating with um, any other like partner? If you don't yet have a team, yeah, and probably if you want to mention about the company or organization you're representing, that will also be fine. So I think we'll keep on having that going on, so that as we look at the chart, probably you can maybe find somebody who has an interest that you might be looking forward to in the snakebite price. Yeah. Okay, so I think at 42 participants, we can kick it off. Maybe I think at this point I will invite our colleague Rob, maybe to just open it up, and then from there Waringa can proceed with the presentation.
Great. Thanks, Ben, and welcome everybody. My name is Rob Beyer. I'm one of the co-founders of Villgro Africa. I'm speaking to you right now from Canada, in Southern Ontario, but I've spent over 20 years in Kenya, and still go back and forth. Now I'm a grandfather in chief, and so we have some grandkids that have us coming back to Canada a little more often. But we've been fortunate to raise our family in Kenya and call Kenya home for well over two decades. This particular prize and innovation is very interesting. When we first met the team from Wellcome and Challenge, it struck me right away after 12 years of doing this at Villgro, no one has highlighted this particular issue around health. And it was, even though there has been work, there has been things done, there hasn't been a real focus around innovations, I believe, around this. And so when we met the team from Wellcome and Challenge, it was really something that really resonated. When I first went to Africa in 1990, both Zimbabwe and Kenya, both times involved snakes and access to snakes, and even back then you couldn't escape. Your awareness was there all the time, and rightly so. Since being involved with both Challenge Works and Wellcome on this particular event, I've been doing more research, and this particular issue, which many experts in the room would obviously know this better than I do, but it's a significant challenge. It is something that's probably not well understood, or maybe not as well articulated, but it's clearly there. The amount of people that are affected by this is significant, and the livelihoods that are affected by this is not small. And so, as Villgro, we're thrilled to be part of the team to be raising awareness and working on innovations and hopefully bringing things to scale that can address this challenge. As mentioned, go ahead and change slide, Waringa. On the next slide, we'll mention the partners who we're with.
Enoch, please change the slides.
Or sorry, is it Enoch? I'm sorry. Great, yeah, and so as mentioned, we have project partners. There's Wellcome, they're the strategic partner and the funder, and sort of the strategic effort behind it. Challenge Works is our design and delivery partner, and Villgro, we're obviously the Sub-Saharan Africa lead to sort of help drive awareness and use our collective networks and strength in order to raise profile of this as well. And so, yeah, with those small remarks, I want to welcome you to this, and please be engaged. I know the team is ready to accept questions online at any time. There's, I think, a Q&A part there. And so we look forward to a dynamic session And thank you for joining.
Great. Thanks, Rob. And so I'll pick it up from the context that Rob has set and just paint a picture of why we're doing this today, and get into the details of what we are looking for. So why this immersion series exists? We're doing this, number one, because we want to make sure that everybody has a clear understanding of the problem at hand, which is snakebite. It is a pressing problem across the continent and across the world. This call is a global call, but for the purposes of today's conversation, it's focusing on sub-Saharan Africa. It is a problem, and we'll look at the numbers in just a little bit. Number two, and this is a very important part, is you need to learn from the field and also from those who have lived experience. Today, we'll be joined by a very interesting panel, one that features someone who has survived a snake bite, and those perspectives are very, very important. And then we'll hear also from others who are on the front lines of tackling snakebite from different perspectives, whether it's making antivenom serums available, whether it's research, epidemiology, etc., etc. And number three, I hope that by the end of this session, we can all walk away with a clear understanding of the opportunities that exist to innovate. And as I know, there's a lot of us on this call who are already working on applications. So hopefully the conversations here today can help you to refine those ideas as you get ready to submit. So yes, so snakebite it's not just a medical problem, but it's one that cuts across logistics, diagnosis, awareness, and we'll get into that in just a little bit. Next slide. In terms of where we are now, so the call is open. It opened on June 17th, and we shall be receiving applications until the 16th of September. So in between this time, please form a team if you haven't already and get ready to submit those applications. We'll then go through a period of looking through them and shortlisting. Then the final list of those who have made it and will be receiving support for the next 3 years will be announced next year, 2027. And then they will receive the support until 2023. Maybe we can go to the next slide. Yeah. So in terms of the problem, we have, go back. Yeah, in terms of the problem, there are about 5 million cases of snakebite every year. And out of this, there's about 100,000 deaths, and about 4 times of that population then gets to experience long-term disabilities or just major changes to their health as a result of the snakebite. What we're trying to do is to halve these deaths and these disabilities that occur from snakebite incidences. Next slide. In terms of the realities on the ground and where the gaps are, and these are also, when we talk about the gaps, this also represents the opportunities for innovation. Number one, there's major delays when someone is bitten, there's major delays in them receiving care. This obviously then results into more severity of the bite, sometimes leading to death. Number two, there's also harmful first aid practices. We do have maybe some myths and misconceptions about how to go about a snake bite, and some of those end up being very fatal. So there's a bit of awareness work that we need to do on this. Another challenge and area for innovation is around transportation. Sometimes there's not easy access for patients to health facilities where they can receive the care, which sometimes leads to deaths that can be prevented if the care was fast enough. Number 4, there's also lots of fragmentation when it comes to referral systems. Sometimes someone is bitten and it's not clear which facility they need to go and how they should get there. There's also a very big gap in terms of diagnostics and the tools that clinicians and also researchers are able to use to tackle the problem of snake bites, whether it's knowing the correct antivenom to administer at the incidence of a bite, in other instances. Number 6, and this one is critical, is around the readiness of facilities. Oftentimes, you'll find either the workforce is not ready to handle snake bites. Not all doctors have this skill set, or sometimes even the materials, the antivenom serums and other medications that are needed are not available. So this definitely creates an opportunity for innovation. We are looking for people who are innovating around 4 key areas of the patient journey. So number one is when the bite immediately happens, we're looking for solutions around that community response, health worker readiness, etc, etc. Number two is access and logistics. We are looking to shorten the time it takes for a snakebite patient to get to a healthcare facility. So any solutions around that are very, very welcome. Another point we are interested in is access and diagnosis. We're looking for tools and technologies that enable diagnosis and treatment to be faster and better. Number four, we're also looking at emergency and supportive care. So that's looking at all the effects that will arise from a bite and innovations surrounding that bit as well. So let's get into the kind of innovations we're looking at. So number one, there's devices. Any technologies that make this work easier, better, and improves health outcomes, we're looking for those. Anything that improves logistics, whether that's rapid transport, better distribution of antivenom, that is something that is being accepted for this. Technology, once again. Financing is a big one. Antivenom is very expensive, and just generally the treatments around snake bites are very expensive. So any funding solutions that make this access easier and better, that is welcome as well. And on top of that, the healthcare access, which we've talked about, and also the social awareness and community response strategies. What is definitely out of scope is antivenoms. So developing of serums from scratch, we are not accepting solutions around that. Primary prevention as well. Basic research, unless they are linking very directly to a very specific solution that will lead to impact at scale. And also things around rehabilitation, mental health support for patients of snakebite, those are also out of scope for this particular challenge. And now I'll hand it over to my colleague Ben, who can go into the different maturity levels of innovations that we're looking for.
Yeah, thanks, Waringa. Now, the price itself is designed in such a way whereby we are interested in innovations that fall in 2 tracks. So one is what we'd be calling a launch track. What we mean by this is would be trying to see how we can be able to get innovations that are new. So this is innovations that are not existing, or innovations that are being repurposed, yeah, so that they could be able to get into the snakebite field. Now, part of this initial phase, what we'd be looking to get is 10 finalists who could be able to receive an award prize of £75,000 to support the development of the innovations. And after the initial phase of support, then from those 10, we'll be able to now have additional 2 who will be selected to receive an award prize of £750,000 to just support the development of their innovations. What we mean by that, I'll speak to that in the next slide. But then there's also now the growth track. For the growth track, we are looking at more of like more of like mature innovation. So solutions that have already been existed, these have been tried and probably just need to be scaled. And when we look at this phase, what we are trying to look at is getting 5 of these who in the initial phase will be able to receive prize money of, let's say, the £100,000. And then after that, 2 of them again will be selected to receive prize funding of £1.7 million. So maybe just to paint the picture here is, as we kick this off, we will have initial 15 finalists. And then after the first phase, we'll be able to transition to selection of 4 finalists who then would be supported with the follow-up funding. Let's move to the next slide. So I think getting into the launch phase, or the launch track. So as I mentioned, here we are looking at early stage concepts that would be seeking proof of concept. Now we have different stages of maturity level that we'd be looking at that cut across these two launch tracks. So for the launch track, we are looking at those that are falling across three of these maturity levels. There are those that are doing initial research, but as you remember, one of the things that we had mentioned, even if we are talking about initial research, there has to be like tangible results or evidence that is resulting from this. There's those that then we are looking also under innovation maturity level 2 that we'll be looking at them having a concept and feasibility being done, and then those in level 3 having proceeded to development and verification. Now, key to note in the launch track, and if you recall from the previous slide, from the two phases, if one is successful to join that, there are of course milestones that are tied to this. So by the end of by November next year, at least one should be at innovation maturity level 2, and then coming into the other phase by the end of November in 2030, at least one should be at innovation maturity level 3. We can move on to the next slide on the growth track. So for the growth track, what we're looking for, of course, is mature businesses that need to scale. So for these ones, at least, you need to be at innovation maturity level 3 to be considered for that. But then in case one is successful to join in this, what will happen is by the end of November 2027, again, in line with the timeline, one should at least have transitioned to a minimum of innovation maturity level 4. And again, by the end of November 2030, at least one should be able to be transitioning to a minimum of innovation maturity level 5. Next slide. Yeah, so in terms of eligibility criteria, I think key thing to point out here is you cannot submit an application as an individual. You must be part of an organization or team up as organizations. So it's eligible open to organizations such as NGOs, research institutions, startups, but you cannot submit an application as an individual. So part of even this series that we do have, and also like even the Snake Hack event that we plan to happen later next month on 10th and 11th, is to be able to bring innovators to be able to come and collaborate from the different fields and to team up to be able to submit strengthened applications. So collaboration at the end of the day is encouraged. One of the key things we try as much as from now and even since the call started is to support matchmaking. And then also note that multiple entries can be submitted, but as these multiple entries have been submitted, there can only be one lead applicant who is doing that submission. In terms of conflicts of interest, what we do have is that employees of Wellcome, Nesta Group, those who are participating in the jury during the final selection will not be eligible to submit applications. And then in terms of the geographical scope of where the innovation is to be implemented, is for us now to look at which are the high burden geographical areas. So this is available on the website itself, whereby we do have a list of all these regions that you could be able to align with. And then lastly, in terms of the submission, all submissions should be submitted in English for the whole review process. Yeah, next slide. Yeah. So maybe just to wrap this up in terms of assessment and judging, yes, there will be technical assessors will be conducting this, combined with a judging panel. So this is bringing together international experts who are vast knowledge in this field, spanning from science, global health, medtech, innovation, to be able to review what is being submitted. And then maybe just go to the last slide in terms of the criteria that we'll be looking at. We'll be looking at impact at the end of the day, which impact is your innovation or submission contributing to. In terms of innovation and contribution, how is the originality of what you're submitting looking like? And then in terms of implementation and sustainability, having like a clear delivery pathway. And then end user understanding. So just being able to align what you're submitting with end user needs, and then strength of the team in terms of being able to deliver the solution. What does that combination look like? And then lastly, we do have in terms of safety and ethics, trying to see how then we also have been demonstrating commitment to safe, ethical and responsible implementation. So basically just around do no harm principles. So, so I think this brings us to the end of this initial phase. Yeah, we can leverage actually the chat for any Q&As that we might have. I also know the Challenge Works team is here to pick that up. So maybe I think at this point, in the interest of time, we could transition to the next phase, but feel free to leverage the chat function that we do have to ask your questions. We'll be able to respond to that. Yeah, so I'll hand it over back to you, Waringa, at this point, yeah? So that we can transition to the next phase.
Great. Thank you, Benjamin. Yes, so at this point, we will now transition to our panel. Maybe Enoch, you can show the slide with our panelists. Thank you. Yes, so today we are joined by a really, really dynamic panel. 4 of them will be speaking to us here, and then one, Dr. Robert Ofwete, will be facilitating one of our breakouts right after the conversation. But at this point, let's go ahead and jump right into it. Now, for those who didn't join the first Immersion series webinar, that first conversation was mostly around just grounding the conversation in the realities of the patient journey and what that looks like. Today, we are taking things further and really just narrowing down into, with that in mind, where are the opportunities for us to innovate along this patient journey of those affected by snakebite. So without much further ado, we'll go ahead and get started. And I'd like to start with our first panelist, who is Washington. Washington brings lived experience, which is very critical to this. So Washington, you feel free to get off mute and turn on your video if you're able to. And my question to you is, given that you've experienced a snake bite, from your vantage point, what would you say are some very critical challenges from your experience that you believe innovators should prioritize in solving? And you can introduce yourself, then go ahead to give us your insights. Washington? Maybe he's having a technical challenge. So I will move on to our next person just as he figures that out. Maybe Irene, I can come to you. Now, Irene is someone who focuses on access to vaccines and also antivenom specifically. Maybe Irene, you can come in and tell us from your experience improving access to vaccines and also other antivenoms and biological supplies that are relevant when it comes to snake bites. What would you say is the greatest opportunity for innovation to perhaps improve the equitable access of this very needed life-saving treatments like antivenoms.
Very much, Waringa. Am I audible?
Yes.
Thank you. My name is Irene Kimeu. I work in biologicals, vaccines, and antivenom access across Africa. Over the years, I've collaborated with ministries of health, regulatory authorities, procurement agencies, healthcare workers, manufacturers, development partners, and mainly to strengthen equitable access to quality assured biological products. And these include antivenom, snake antivenoms. Today, I think I can just share a small lightning perspective that access, according to me, is much more than availability. It is the ability of every patient to receive right antivenom at the right time through a prepared health system. So antivenoms are region-specific, and countries should prioritize quality-assured, evidence-based, and regionally appropriate products while discouraging unregulated or inappropriate products that may appear cheaper but can compromise the safety of the patient and the outcomes. And we have quite a lot of stories to tell in this regard. So true access requires policy, regulation, financing, procurement, distribution, very important, healthcare worker training, and we do a lot of these kind of processes, referral systems, affordability of the healthcare, and pharmacovigilance. So it doesn't just end at the point where the patient receives the antivenom or the treatment regimen, but also follow-up to see how the outcome was. So I think, and I want to emphasize that innovation is not only technology, but it means improving the governance, financing, logistics, partnerships, and clinical readiness. Waringa, can I continue or can pause that now?
I think you can pause there for now. And we hear from Dr. Rono, because you do bring up some very, very interesting perspectives. And now you touch a little bit on the clinical bit of it and the actual management of the bites that happen. So maybe Dr. Rono, we can call on you at this point, because you bring in a very, very critical health systems perspective. So from your vantage point, where do you see these opportunities for innovation, and also just building on what Irene has shared with us?
Thank you, and Waringa and everyone else. I hope I'm audible.
Yes.
Yeah, thank you very much. First of all, I was to say I'm excited for this prize because it's not normal to have snakebite being in the forefront of the world. So it's very nice. So from this, so from a healthcare system perspective, we need innovations, first of all, in community education. So I work in a county or a region where snakebite is very common. And one thing you realize is that communities are not aware of the risk or the type of snakes that are within their areas and how venomous they are. So patient education and community is a key aspect so that we can be able to prevent or reduce the number of cases. So any innovation around creating awareness, people knowing, just, in fact, I get photos from people asking me, is this snake venomous or not? So just identifying snakes that are venomous can be a very good innovation. Then getting the patients to healthcare in the right time. So we usually have a lot of delays in that most cases occur in the fields, in the farms, in the grazing fields. So how do we get that patient to the health system in a good time? Then finally, the health system, our nurses, our clinical teams, are they really able to manage? First of all, identify that this is a snake bite. What are the symptoms, the signs, and how do you manage the patient? because many times our training does not really empower us to manage snake bites successfully. Yeah, so there are a lot of missed gaps. So generally, I'll say the innovation space is so wide, and there is need for innovation in almost each step. And maybe I'll stop there and maybe talk later for any other question that I missed. Thank you.
Thank you, Dr. Rono. You surface some really interesting points and also give really good examples on some of the innovations that people in the room can be thinking about, including IDing of the snakes, and also you brought up important element of capacity building of health workers, ensuring that they're well equipped to actually manage the snake bites that come in through the door. Now, since we are talking about patients and that experience, I want to check back on Washington and see if now he may be able to chime in on this conversation. Washington, are you able to hear us? And if so, are you able to just speak to us a little bit about your lived experience with snakebite, and from that vantage point, where you see opportunities for people to create solutions around? Feel free to go ahead. Hi, Washington. Are you try say something so we can signal if we can hear you? Okay. I think we are having a bit of a technical issue here, but maybe Washington, try to maybe restart your device and we'll come back to you, because I do want to ensure we get your perspectives. But at this point in time, maybe Benjamin, we can jump into breakout sessions. And the point of the breakout sessions is for us to continue these conversations. And number two, for the people here to get to know each other. I know some of you are looking for teams. Some of you have expressed a particular point of interest in the patient journey. And we've divided the breakout rooms based on your expressed areas of interest. So I'd like for us to continue conversations there. Each of our panelists will be a moderator in each of the breakout rooms, just to help us think about further solutions that are relevant in that juncture of the patient journey. We'll have that conversation for a few minutes and then take notes. Someone in the room should take notes so that we can come and debrief and have a broader sense of what those ideas that are coming up are in the different rooms. Benjamin, is there something else to add?
No, thanks, Waringa. That's actually it. So maybe we can just transition and we'll be able to provide more guidance in the breakouts.
I believe we have everyone back. I hope those conversations in the breakouts were engaging and dynamic. Before we debrief from what we've been discussing in the breakouts, I want us to hear from two people. One is Dr. Rita Salifu. She's also on our expert panel for today, and she brings lots of insights from Ghana in public health and research. I want her to share her perspectives on some of the opportunities for innovation from her vantage point, and then she can proceed to share what were some of the highlights from her breakout room. Dr. Rita, feel free to go ahead.
Thank you. Great to join this team. So much information and knowledge. And it's like Dr. Rono said, when we started this journey, it was very lonely. So it's exciting to just see so many people coming on in the journey of snake bites. And it's growing so well. So I'm Dr. Rita Salifu from the University of Technology and Applied Sciences in Ghana. And I have been working in snake bite for a period. I started off looking at access and availability to anti-snake venom treatment, and later on moved on to impact and looking at that. So just a few quick thoughts that we can consider as we think of innovation is to look at integrating the traditional health workers in the referral system. So in a lot of my research, first aid response, communities were going to the traditional medical person, the traditional healer, and there were beliefs, and also the fact that they were closer. And so when we talk of delayed response, reaching health centers, we cannot ignore them and just say the biomedical scientists or the clinic or health facility. We should consider how we can link this up. And we do have a program in Ghana in terms of bone setters that we've been able to do something like the bone setters working with the orthopedic doctors to try and do that so we can kind of bridge the gap. It's something we could think about, but also to look at snake bites, not just as an emergency, but also as a development challenge. Aspects we can look at is the socio-economic impact of it. How can we manage that? The patient does not die by God's grace, but the life is impacted. If it's a farmer, and he's bitten and rushed to the hospital, we do all the things fast. Now he can't go to farm. The rainy season does not wait for him. There's a loss of livelihood. Children probably have to stop school and jump in. Wives have to go in there. They stay in the hospital for a period. So early response may reduce the time they'll stay in the hospital, but within that period, as the person who is raising all the funds for the family, that person then is inhibited and it impacts the social economic burden. Another impact we have seen is when there is a disability from snake bite. So those are ways we can look at that. And then finally, also the mental health part of it. So I had people who reported to me that anytime it rains, they feel that the snake is still moving in their leg. And this after treatment, and then there's a stigma, you've been bitten because you've been cursed or something. So if we can find ways to be integrating counseling services in reaching out to our health, our clients and victims, and in our awareness creation, I think that those three areas, addressing the socioeconomic and social barriers and burden that snake bite impacts, looking at the disability and what it has, and also looking at the mental health awareness and addressing this, whilst ensuring that the referral system links it. As much as we want to prevent snake bites, most of this happens in fishing, farming communities. That's their livelihood, and snakes are there, so we have to see how we can manage and coexist and still have a fruitful life. So I will end on that and just give a few summaries from my breakout group. We had a very interesting group. We had people from Ethiopia, Zimbabwe, where again did we have, of course, Kenya, Ghana. And the ideas were interesting because we found a lot of synergies. So we found that most people, both healthcare workers and community people, don't even believe that there are non-venomous snakes. Every snake is to be killed and sent away. And even understanding that and the species of snakes impacts even treatment. And so some of the points raised was for our healthcare workers to have capacity, our community health people to have more knowledge and have capacity. A very strong discussion point was data. If we're trying to look at target audience, we were all moving between children are more affected, men are more affected, this person, but where is the data to give us more information to tailor our innovations towards that? And so we looked at that. And yes, very high on the list was emergency response and referrals and how to connect that. And then sustainable partnerships. Who can we get to join in? A very good point from one of the countries was there are packages that are already going on. Can we add on snake bite treatment to those services that are delivered to create awareness, to build the capacity? So we are still looking at how to leverage management of snake bites and helping in innovative ways using existing systems so there's no parallel system, and hopefully that can address cost and innovation. So great group we had over there, and our thoughts will be shared further. Thank you.
Fantastic. That sounds like it was a very, very dynamic conversation that also brought perspectives from across the continent, which is good. Great. So I don't know, maybe we can go to, I want to check. Washington, are you able to hear us now and are you able to speak? No, that's okay. So I say we proceed with the sharings from the other groups. So maybe Dr. Rono, you can share what some of the insights were from your group, from your room. And you were in the first aid and response, correct?
Yeah,
Yeah,
thank
go
you,
ahead.
Irene. Yeah. So we had a very also animated discussion. We had participants from Bangladesh, Nigeria, Ghana, of course, Kenya, and Nigeria. So on the issue of first aid, we were able to realize that snake bite is usually an emergency, time critical, and it's usually unfortunate. So the person who is bitten was not prepared for it. Yeah, so the issue is most of the time the interventions that are done are very hurried, sometimes are harmful, and then it actually delay access to care. So there's a need to see how to change behavior of the communities on the first aid practices to come from harmful practices to useful practices. Of course, it affects mostly the poor. So there was a need to do model studies to understand what are the first aid practices amongst communities. So because we cannot intervene without understanding how communities respond to snake bites. So different communities respond differently. So there's a need to even have a baseline level of data so that you can know how intervene and teach them the right thing. Yeah. And as every community has its own practices, whether right or wrong. So how do we harmonize and give a good package on how to do the right thing for snake bites? And also now refer for antivenom. Yeah, and there's an example where you see a patient is bitten and they go from facility to facility looking for antivenom, and if they don't find it, and finally they might pass away because of not finding the antivenom in the right place. Yeah, so again, we realized also there's at the community level, there's low knowledge or awareness on first aid of snake. So there's a need to empower the communities on that. One participant also was able to say that there's no consensus on the first aid education. Different countries, different organizations have different recommendations on first aid. So we need to have region-specific or area-specific first aid education materials. So on the solution we came up with, we realized any solution should be able to empower the community to get away from harmful practices and have a change and to be able to quickly refer. Yeah, so there was a lot we talked about. Let me just stop at that.
Thank you, Dr. Rono. Lots of great ideas coming out of that room. I hope everyone else is taking note, especially if there's people that still are looking for collaborators. Irene, maybe you can tell us some of the things that surfaced in the access and logistics breakout room. I think we may have lost Irene. Dr. Ofuete, maybe you can tell us what came up in the assessments and diagnosis breakout room.
Sure, Irene, and thank you so much. I think the issues cut across what have been mentioned by the other two breakout rooms, but most importantly is that we had a participant from Denmark dealing in rapid diagnostic kits for snakebite. We had someone from India in the business development. We had one from Kenya who just did her research on data, and she's trying to see whether she can actually improve on her work to be able to have AI models for predicting snake species based on the bite. But most importantly is that even when we have these solutions, logistical and supply chain concerns came up. How do we ensure last mile distribution? How do we ensure equitable allocation and distribution of these commodities? And so having data to guide us with regards to forecasting, having data to guide us with regards to the burden estimate, having the tool to guide us with regards to distribution of these snake species, and having data to guide us with regards to the burden of snakebite victims is really key to ensure that we have adequate number of the diagnostic kits in the right area and the right time and in the right quantity, as well as the antivenom and other adjunct therapies. Finally, we concluded on capacity building, which is critical in the SSA region with regards to management and treatment of clinical management and treatment of snakebite. But then capacity building is not a one-time affair, and it's really expensive. So having guidelines at the national level that actually harmonized and distributed to facilities on the subnational levels in terms of quick reference materials such as job aids and manuals, and having innovations that can ensure frequent or rather recurrent reference and retraining of clinical health workers with regards to snakebite management is really key, because one-off training will not suffice, and recurrent trainings are unsustainable and expensive. Thank you, and over to you. Back to you, Irene.
Great. Thank you. Thank you, Dr. Ofwete, for that comprehensive feedback. Now, Irene, might you be in a position to share what came up in your breakout room?
Thank you. And sorry for that small pitch. So we had a very interesting discussion. We had participants from Burkina Faso, Namibia, Kenya, Zimbabwe, and the first important thing that we realized is that we need to improve access to quality assured antivenoms, and we discussed how to even make sure that it's the right antivenom, and then this has a lot of facets around it, even mapping out the distribution of the snakes in the particular countries, the venomous snakes, and maintain buffer stocks. We are even thinking about having an antivenom bank, and strengthen last mile distribution as a second point. This has to improve supply chains to rural and remote facilities using data to forecast demand and optimize distribution. We're also looking at reducing financial barrier, and this circulates around policy and advisory, where we sit down with the budget makers and the processes in the Ministry of Health and the Treasury departments in every country, so that we include snakebite treatment and maybe universal health coverage, and subsidize and provide the antivenom maybe for free or completely subsidized to the people who need it. And then we improve geographic access. We're looking at solutions around the distribution chain. And then we're also looking at building healthcare worker capacity. This has to do with training, development of standard treatment protocols that we agreed that it's an area that is of focal point, so that we make sure the doctors are doing the right treatment processes. And then also increase community access to information. Previously and even right now, there are so many communities we don't even know we have a solution to snake bites, and you find they are going to the remote snake handlers or traditional healers, and they are failing quite a lot. And there's something about strengthening surveillance and digital health, a lot of work around that. And I wanted to mention a very important point in regulatory strengthening. We had a very nice feedback from Namibia, and we're looking at, apart from what WHO regulates, which we shared, now there's a very active vaccine department at WHO, which is regulating the efficacy and safety of the snake antivenoms, and also regulation in bits that it's region specific. Snakes are not the same everywhere, and the region-specific antivenom availability and suitability is strengthened by having local solutions in the regulatory authorities that even advance and encourage clinical trials locally to check the suitability of even those antivenoms that are recommended by WHO, and a lot of work around the snakes that are not covered in the antivenoms. We are out to imagine and bring solutions in the symptomatic healthcare management for those kind of outcries of patients who are bitten by snakes that are not even covered in the regulated antivenoms. In that case, we also need to check around having the right antivenom. So what our final statement is that access is answering the question of having the right patient receive the right treatment at the right time. If any solution will bring us to that conclusion, then we are good. Thank you very much.
I like that. Thank you, Irene. The right solution at the right time. I think that's a good way to sum it up, and also to just sum up what we are trying to do here with this challenge, which is to get the right solutions to the patient that needs them the most at the right time. I hope these conversations have been really interesting for you all, especially as you put together your applications and refine them. Hopefully someone who came in without a team has maybe left with a very strong lead on a team that they can join. We also want to let you know that there's an upcoming event in Nairobi on the 10th and 11th, which will be an in-person event. We'll have a hybrid option as well. But the purpose of this is to continue these conversations and to continue the refinement of our applications ahead of the deadline for submission. So feel free to have a look at that. It's on the Wellcome Snakebite Innovation Prize website, and I'm sure it's been dropped here in the chat as well. If you have any more questions, need any further information, feel free to reach out via any of the channels that have been shared here today and in the chat. Unless there's any final remarks from anyone on my team, we can wrap it up here. Benjamin, is there anything further from your side?
No. I think maybe just to appreciate everyone for creating time to be a part of this. This has actually been insightful, and also I think it moves us from framing the problem to start to frame solutions. So we still have an open window, actually another 2 months still open all through to September. 16th of September. So I think it's just for us now from these learnings to see how we sort of strengthen our applications, see who are the probable collaborators to team up with. And I think once we also get to the snake hack, we'll be able to see how to also support in this. So more details around the snake hack are available on our online platforms. And lastly, just as I close it, a big thanks to the Wellcome Trust team, ChallengeWorks, and also the Villgro team here. Yeah, thanks everyone, and have a good rest of your day.
Thank you, everyone, and especially to our contributors. Thank you all.